of Health, the truck drivers. 9 of them tested positive earlier today, and the truck drivers are going to be tested before they depart any movement. And now there's a call to close the Namanga border. So Kenya has now hit the 700 mark in total number of infections. 28 more cases were confirmed in the last 24 hours alone, raising fears that the worst may yet to come. The latest flashpoint seems to be long-distance truck drivers, with 9 drivers testing positive in the latest numbers. Chemutai Goin reports that pressure is now mounting on the government to shut down the Namanga border.
Health officials donning protective outfits stationed at the Namanga border took time to cancel truckers who are receiving their results. This was before it was confirmed that 9 had tested positive for COVID-19. Dr. Maria Tonkei, who leads the team collecting samples, revealed that the truckers were tested on Saturday.
The reason why we are here, we were giving them the results and also to evacuate our positive cases to our facilities to receive further management. So for Kenyans, I think from the CS Health, you got the number, we got 9.
Hours later, ambulances from Kenyatta University Referral Hospital, where the 9 will receive treatment, arrived to pick them. This then paves way for the all-crucial contact tracing. Namanga, just like the other border crossings in different parts of the country, is on the government radar as one of the possible hotspots.
We also test Tanzanian drivers who are intending to enter Kenya through that border. 5 of those Tanzanian drivers were found to be positive.
Naomba serikali ichukulie hatua sana hii border, kama hata ni kufungwa tena ifungwe kwanza kwa muda kidogo tu.
And it appeared EAC guidelines launched yesterday dictating the movement of goods and services during the COVID season had begun taking effect regarding the non-repatriation of truckers who test positive on one side of the border. Other directives includes that a maximum of 3 people, including the truck driver who have undergone prior testing, be allowed on a journey. Close monitoring will be done at select checkpoints where drivers will present clearance certificates. Truck drivers will be screened twice a month. Anyone exhibiting COVID-related symptoms will be quarantined. A raft of other directives will see customs waive the time limit for departure and exit of the goods to allow for the time spent during clearance. There will also be specific stopovers for truckers, and for those who must be placed on quarantine, designated facilities have been outlined. And in the event a crew tests positive, as did the 9, alternative crew takes over. Besides tracking and containing the possible spread of the virus through truck drivers, the government will be heightening surveillance at the border points to ensure no one uses illegal routes to access the country.
And when you see people coming across from the other side, you inform the authorities so that if those people can be tested and isolated if necessary, if they turn out to be positive.
But already the proposal on designated testing facilities is facing resistance. This is the Miritini Municipal Dispensary, located in a residential area. Residents here protesting that the government was putting them at risk. Truckers who came in for the crucial process, lamenting over the hefty fees and long queues.
Haiwezekani walete watu wapimwe hapa na sisi tunafanya biashara hapa. Sisi tuko safe tukiwa Miritini. Tuko na watoto wanatembea kila mahali. Unaona? Hapa tunapelekanga watoto wetu clinic pale.
Hii hospitali yenyewe inasaidia wale kidogo. Je, madereva akija kujazana hapa, mama huko wamejikenda ambao wanaweza kusaidika ataenda wapi?
Hapo kuna stopovers nyingine kama Mariakani kwenyewe hakuna parking. Kuna stopover nyingine ambayo ni Athi River pia hakuna parking. Hata tunavyozungumza kuna madereva ambao gari zao zimeng'olewa plate number Athi River.
Our priority intervention measure in the new month is to limit community spread of the virus.
As more measures were imposed, 28 more Kenyans tested positive for COVID-19, pushing the number of infections to 700. There were 12 recoveries. Unfortunately, a 33-year-old man succumbed to COVID-19 as he was receiving treatment, a factor that has caused the Ministry of Health to review its case definition procedure. Soon, before being admitted for other ailments, you will be required to undergo a COVID test to avoid infecting health workers and other patients.
This will be able to implement in a stepwise manner so that it does not also become an obstacle to somebody getting a service, so that the healthcare workers do not use the COVID test to be able to deny you treatment for any other pre-existing condition.
In the coming days, the government will resume targeted mass testing in various hotspots, including the areas they have already done a series of tests. Chemutai Goin, Citizen TV, Nairobi.